Hey everyone, it's Dr. Nurse Tutor, and as promised, I am back with another video. I have noticed that across the board in all of my students, they have been struggling a little bit with the respiratory system. So today I want to give a respiratory style, NCLEX style, exam style question. Let's break this down and try to rationalize what the best right answer would be. The question goes, the nurse is taking the health history of a patient being treated for emphysema and chronic bronchitis. After being told the patient has been smoking cigarettes for 30 years, the nurse would expect to note which assessment finding. The answer choices are increase in forced vital capacity, a narrow chest cavity, clubbed fingers, and an increased risk of cardiac failure. So increase in forced vital capacity, a narrow chest cavity, clubbed fingers, and increased risk of cardiac failure. Go back to the question like I always say. This patient has emphysema and chronic bronchitis. Out of COPD, chronic obstructive pulmonary disease, your patient has both emphysema and chronic bronchitis. The patient has been smoking for over 30 years. What would you expect to notate in this patient as an assessment finding? An assessment finding of someone who's been smoking for 30 years, has emphysema and chronic bronchitis. Would you expect to see increase in forced vital capacity, a narrow chest cavity, clubbed fingers, and an increased risk or an increased risk of cardiac failure? Two of these answers we should be ready to execute, that they are not correct answers. And if you look here, out of the four, increased forced vital capacity. Increased forced vital capacity means how much air can the maximal amount of air that your patient can let out after inhaling. How much air can your patient push out? We already know with patients who have COPD, emphysema, chronic bronchitis, their forced vital capacity is decreased. They are not going to be able to push out a maximal amount of air when they have fibrotic lungs, fibrotic bronchioles, fibrosis of the alveoli, of the bronchus, fibrous tissues. They're not going to be able to push that air off. So they shouldn't have increase in the forced vital capacity. Your patient also, we should know that the patient is not going to have a narrow chest cavity. This patient is going to have a flattened diaphragm, and this patient is going to have a barrel chest. We should know that with COPD patients, they're going to have a barrel chest. So they're not going to have a narrow chest cavity. They're going to have a flattened diaphragm, and they're going to have a barrel chest. So those two should be executed. They should be removed as answer choices that do not make sense. Now we're left with two circulation answers. I always tell you guys, airway, breathing, circulation, right? We're left with two airway, breathing, and circulation answers. 3 says clubbed fingers. 4 says an increased risk of cardiac failure, right? They're both correct because this patient who has COPD has an increased risk of cardiac failure, and this patient who has COPD has clubbed fingers. So how do I know out of these two, which one will be the best right answer? Go back to the question. The question says, the patient has emphysema and chronic bronchitis. They've been smoking for 30 years. What am I, as the nurse, expecting to see in my assessment? When you're assessing your patient, what are you expecting to see in your assessment? Not what your patient is at risk for. What are you going to notate during your assessment, right? During my assessment, I'm not going to notate that my patient has an increased risk for cardiac failure. During my assessment, what I am going to see in my assessment of someone who's been smoking for 30 years and has COPD, emphysema, and chronic bronchitis, I know that I'm going to see clubbed fingers in my assessment. I know in my documentation, in my nursing care plan, I'm going to say that this patient has an increased risk of cardiac failure. But I know on my assessment, I'm going to put down in my assessment that this patient has clubbed fingers because I know for a fact, if you've been smoking for 30 years, you have COPD and chronic bronchitis, you got a circulatory problem. We got a problem with gas exchange in the alveoli. Oxygen is not perfusing well with blood because we have a gas exchange problem. This patient probably has cor pulmonale. This patient probably has right-sided hypertension due to the fibrosis, the fibrotic changes that's going on in the lungs, which means oxygen and blood is not having a proper gas exchange. So the only correct answer would be be that your patient would have clubbed fingers. That's what you're going to see on your physical health assessment of your patient. All right. I hope this helped. I hope this helped you to narrow down the best right answer. I will be back with more questions. If anybody has any topic areas that they're having trouble with, let me know. If not, I'm just going to find practice questions and we'll go over it based off of what I'm noticing in the classroom. All right. I hope this helped. I will see you guys later in the next video. Bye for now.